Okay, I'm back again. This is me, Dr. James Davies, clinical lead. So this bit doesn't take very long. We thought we'd just put in a bit at the end about what the service is available and how do you contact us. So at STH we have a variety of palliative and end-of-life care services. The relevant bits, I guess, are, so we have palliative medicine outpatients. There are patients who are suitable to come out to outpatient clinic. We have a hospital specialist palliative care team. So if a patient is admitted to the hospital under a different care team who has some specialist palliative care needs, they will refer to us and we will be able to provide some of their palliative care input alongside the acute admission. We also have an inpatient unit at the Northern General Hospital, which has 18 beds. It's sort of like an NHS hospice, does the same sorts of things that St Luke's will do. We're just on site at the Northern General, so sometimes we're closer to the CT scanner. The other really important service which Hannah has mentioned is the intensive home nursing service. So they are there to try and help us prevent end-of-life care admissions or get people out of hospital who want to be at home, and care is the hold-up. We have a, they're not a, they can be used by CHC as a fast-track care provider, but not necessarily as the first go-to person. But in an emergency, we should be able to use the intensive home nursing service. So I guess the main thing I wanted I mean, everyone knows about the inpatient units, but the service that not everyone knows about is that Monday to Friday, 9 to 5, anyone can get hold of a palliative medicine consultant at Sheffield Teaching Hospitals. We have a mobile phone that there is always someone carrying, which you can either get through single point of access. I think it's option 3, if that makes sense to anyone. And you can use that phone just to talk to a friend, just wanted to talk through the situation, wanted some prescribing advice, I want an admission, I'd like someone to come to clinic, I don't know what to do, whatever it is, we don't really mind. Someone will answer it and hopefully we'll be able to help. Like Hannah said, we don't always have a bed on the day because we have a really high bed occupancy, which is really annoying because what you want is a bed occupancy of about 85% so we can respond to your emergency, but at the moment we just can't do that, so we tend to be full. But if we can make a plan to keep someone at home for a day or two, then we can normally get them in pretty quickly. So either STH switchboard or single point of access, want to speak to the palliative medicine consultant, Monday to Friday, 9 to 5. Outside of that time, there is an on-call service which includes St Luke's and STH. It's sort of hosted by STH, but it might be a St Luke's consultant, it might be an STH consultant, and our registrar. So they are contactable out of hours, but very happy to be contacted at any time if you just want to know, you just want to speak to someone who might be able to help. And I think that's probably all I'll say, because there's not much time left, is there? Yeah, I've covered that.